Hi, I'm Allick Delancy. I'm a psychologist and I specialize in the area of mental health and education. And today's topic is how teen depression can manifest in schools, symptoms, and diagnosis. Keep in mind the statements made here are based on my views or opinion as well as research I will have done for this video. I will put the links in the description based on my research. The content presented here should never be used as a substitute for direct medical or psychological advice from your doctor or other qualified clinician. This video is based on my personal desire to bring to consumers the science behind mental health and related behaviors. So let's look at the topic of how teen depression can manifest in school, symptoms and diagnosis. Keep in mind this video does not cover all the information dealing with the topic of depression in teenagers and how it can manifest itself. It's only a sample of what can be seen in teenagers who are experiencing depression. Now, according to the Mayo Clinic, it says that teenage depression is a serious mental health problem that causes a persistent feeling of sadness and loss of interest in activities. It goes on to say it affects how the teenager thinks, feels, and behaves, and can cause emotional, functional, and physical problems. Although depression can occur at any time in life, symptoms may be different, and this is interesting, symptoms may be different between teens and adults. So you can actually see variations. Let's talk a little bit about emotional changes in teenagers who are experiencing depression, as well as some behavioral changes that you can also observe. So, firstly, let's talk about the feeling of sadness, which can include crying spells, and this can appear to be for no apparent reason. So, here it is, the teenager comes to school and they may just burst into tears, or probably during class time they cry a lot. They're working through a project, maybe it's a group project, and they're working with other students, and they're also very emotional, they're very sad, melancholic in their expressions, and they cry a lot. Maybe it's time to go outside for recess or for a break, or probably it's lunchtime, and the teenager may just start crying, and for persons around them they may not know exactly why. There might be no apparent reasons as to why this teenager may actually be crying, and a matter of fact, to the teenager themselves it might be a difficult thing to figure out why they might even be sad. It may not be anything that they can think about necessarily that trigger this feeling of sadness or contributing to why they're crying. However, they do feel this genuine feeling of sadness, of loneliness, and it appears that it is not passing for them. So it's just going on and on and on. Another point to note with teenagers who might be experiencing depression has to do with their feeling of frustration, feeling of extreme anger, and it may even be in small matters or matters that may not necessarily one may think is needs a kind of aggressive response to which a depressed teenager may demonstrate that level of aggression or that level of frustration. So this isn't to say that only in depressed teens you will see possibly high levels of aggression or high levels of frustration. You may actually see this in teenagers who show uh, conduct disorder, or you may see it among teenagers who show antisocial personality type, or even probably in the ADHD or the intermittent explosive expressions of anger. However, the depressed teenager also shows or can also show high levels of frustration and annoyance and anger towards even authority. So it's something to note. Also, too, there can be feelings of hopelessness or emptiness. And you have a number of teenagers actually talking about this, talking about feeling like they can never be happy. They are just hollow. They are melancholic. They are empty. These are some of the expressions you may hear that a teenager who is experiencing depression may talk about. They may talk about, if I'm gone, then nobody will miss me. Or they may talk about suicide and leaving this life or leaving this world and dying or going to join someone else who probably may have died. You hear them talking, some of them may talk about that, not all, but some depressed teens may actually talk about it openly. Others may just keep it inside, and you may have to allow them the opportunity to express themselves, maybe over a long period of time of them developing some level of trust in you. So it's not that all depressed teens will openly talk about self-harm or suicide. Some may not, but generally they talk about a feeling of emptiness, loneliness. If someone looks at them, they are almost certain the person could see right through them because there's nothing there. They talk of just being in a shell. And this brings us to another point that some depressed teens talk about. This has to do with being or feeling a sense of not being interested in what they previously were interested in. So, things that may have contributed to bringing pleasure or activities that may have contributed to bringing some level of pleasure to that teenager, they talk about not being interested in that anymore. They become more like a loner, so they may not socialize with their friends as much as they used to, or it can be that they no longer engage in sports or engage in going to the gym, something that probably they had really loved at one time. You may find the depressed teen not engaging in those activities, maybe not going out to the movies. At one time, they used to go out, they loved the movies, they loved socializing with friends, they loved talking on the phone or texting on the phone, and suddenly they are more reserved, probably not coming out of their room, not going to school. And if they are in school, staying in the classroom, probably hiding away in the corner of the playground and not actually being with the other students on the school compound. So you may see that kind of behavior in the depressed student, that isolation behavior. You may actually notice that if they used to be involved in playing a musical instrument, they're no longer interested in playing that musical instrument. They're no longer interested in studying. So at one time they may be a very good student or probably an average student, but now they're not involved in any kind of academics, or the academics doesn't bring them the level of joy. Maybe they're doing it, but it doesn't bring them the level of joy that at one time it used to. So there's a kind of loss of interest in activity, loss of interest in things that at one time brought some level of pleasure to them. And even things like high absenteeism, because they may not want to go to school, so there's high levels of absenteeism. And if they do go to school, they tend to sometimes break class, zone out in classes a lot, not complete work, or if they are in school, they tend to not complete projects as they probably used to at one time. They may not necessarily be as dependable because they just don't turn in anything. And if you put them in a group, it may bring some tension in the group because that depressed student is not really involved in the group. So let's talk a little bit now about diagnosis. Now, physical and emotional effects of diagnosis. is important to note in a depressed teen. So, when a teen is experiencing depression, a doctor may typically perform these examinations. Now, it can be a physical examination, or you may actually have mental health practitioners also performing psychological examinations. Let's talk a little bit about physical examinations for a little while. So, these are the examinations that a doctor will typically perform if a teenager is showing signs of depression. Now, in some cases, the depression may be actually linked to an underlying physical health problem. So, in the first instance, this is where biology is affecting emotions. So, the biology is affecting emotion. What do I mean here? Well, I mean that the teenager may have issues with their thyroid glands, or they may have low blood glucose levels, or they may have challenges with anemia. So the red blood cells may not be at a healthy level. So that teenager may feel low energy, a general feeling of being unwell, and they may express that. So they may stay in their rooms, they don't move as much, they're very gloomy, they're sad, they're tired, or they appear to be just exhausted. So they're not involved in activities. And that could be as a result of blood glucose, thyroid issues, uh, possible tumors in the brain, challenges with red blood cells, and other complications that could be as a result of physical abnormalities that contributes to depression. I even saw in one study it looked at depression and stroke, and it was making the point that there's an association between where the lesion is located on the brain and the risk of depression. I also saw another research that looked at studies linking seizures and and depression in teens. So early experience of a child seizing and depression later on, there is appearing to be a connection. So I thought that that was an interesting piece of research as well. Now, the second part of why a doctor may perform a physical examination, and this has to do with obviously once they detect any kind of issue, physical issue, then they can now treat with medication. They can treat with counseling as well. General education around the physical abnormality. So this second issue has to do with the perception of a severe chronic physical illness. So the teenager may have a perception of a severe or chronic illness. So we're talking about illnesses that they may have, such as diabetes, heart disease, arthritis, kidney disease, HIV/AIDS, lupus, multiple sclerosis. So based on their perception, the teen may start questioning why should they continue living with this condition. They may have probably researched some stuff on the internet or probably talked to some persons, or they just believe that these physical or chronic, while severe, physical ailments is like a death sentence for them. They may not necessarily feel like they should continue going on, continue living, and this can trigger depressive symptoms, this excessive worrying. Now, this teenager, once they have the opportunity to understand that there's medication there, and they even understand something or the truth surrounding the severe or chronic ailment, that could help them to start to reason a little better in their mind, recognizing that, okay, if I take my medication, if I do these exercises, if I have a different outlook, then I don't need to necessarily be depressed over it. So the doctor may perform these physical tests to identify if the depression is as a result of these physical ailments, and if so, to educate the teenager and the teenager's support group so that the teenager does not have to feel isolated or alone with these physical ailments, and as a result, depression takes place or takes over. You may also have a psychological evaluation that will definitely need to be done. Now, a doctor could perform some of it. You may also have mental health professionals who are geared more so to perform the psychological evaluation. So you may have a psychologist, a psychiatrist, a counselor, mental health social worker that may do a questionnaire or a series of questionnaires, and they're looking to see what might be the teenager's response to their thoughts, their feelings, and their behaviors. Now, the objective here is so that the teenager can now have a diagnosis in some instances. And it might be that they are diagnosed with depression or some type of depression, and they are now able to receive medication or to just have counseling, or probably both. Because in some instances, the teenager may actually need some type of psychopharmacological drugs and some kind of psychotherapy. So once the assessment or the psychological test yields that there's a mental health disorder, or possibly just traits associated with a mental health disorder, so the teenager may not necessarily meet all the criteria for mental health disorders such as depression, but they may be showing signs of depression, and therefore early interventions with therapy can help them out quite a bit. So depression is something that really affects the teenage population. It's real, and it can be very, very debilitating for a number of them. So here's where adults, support groups, other teenagers now have to rally around, or should rally around, these ones, helping them to cope, helping them to treat with the situations. And for parents and teachers, it's important to identify these students so that they can be referred or recommended for physical or psychological evaluations. So I hope that this video presentation, the content was quite valuable. If so, please do not forget to subscribe, like, and you could also share this video with someone that you think can benefit from this information. Until then, take care.